explain to people that as you age, that you need to pee more frequently.
Okay.
I have cottonmouth.
What?
Hi.
Hey,
Oh.
we're here!
Oh, wait, let me tap it, I think. That's okay. I think that was fine. Nobody...
Brenda's monitoring our technical aspects tonight. Thank you, Brenda, for your
I hope so.
participation.
I hope she is. Oh, you are.
Chilly, Willy,
Oh,
Cool
hey.
Breeze Tuesday. Happy spring.
It's Kim and Maribeth tonight until Pauline comes in shortly. She's
She'll be
busy,
here.
busy doing doctor stuff, so she'll be here to join us. But we could not be more excited about Ask Anything tonight.
It is. It's going to be a good one.
We specialize in flying by the seat of our pants, don't we, Kim?
Yeah, doc, therapist, invisible physical therapist.
Yes.
We make miracles happen.
Let's just, if somebody could just let me know if they can hear, that would be super.
Out there in Facebook land, can you hear us?
Nope, you can hear. I got it.
Okay, apparently you can hear. So, write in with your questions. We've taken a few from the clients we've had this week. Should be fun.
Yes, but they can comment them. If they have a question they want answered, they can just comment it, and we will answer on the spot.
Do we earn money and prizes for answering questions?
Is there a buzzer involved?
Regardless of the
Oh
answer.
my gosh, that's so funny. I should have gotten a buzzer. That would have been great. All right, so where do we start? Do you guys want to introduce
We
yourself?
start at the very beginning. A very good place.
You know what I said when she said she was going to be late? I'm like, I'm sure Maribeth will use this time for song and dance.
When you read, you begin with A, B, C. When you sing, you begin with Do, Re, Mi. Okay, sorry.
Julie.
We don't need to torture you all.
No, that was great. What about like who you are and where you're from, in case they need to reach out to your great
recap.
services?
For those new folks joining us, I am Dr. Maribeth Loynes, trained OBGYN, obstetrics and gynecology. I have wellness for women, for all things women's health.
Hello, I'm Kim Morris. I'm a licensed clinical social worker, and I love to talk to you about your relationship with stress.
Here she is.
No, I'm wearing camouflage. Y'all didn't see me come in. What are you talking about?
Yeah,
So,
you've been
Ninja,
invisible.
like, you gotta scoot this way, babe.
But I'm a mom. I'm just
Come
kidding.
on, close.
You are perfect.
Hi.
Okay.
You can introduce yourself.
I'm Dr. Pauline Shiver, physical therapist, and
Dance extraordinaire.
well, I was gonna say inflatable costume lover, but that works too.
I already sang for it.
I heard it. Anyway, glad to be here. Excited.
The fans are here. Okay, I'm just going to go down the line. There were
Let's
some
do it.
good ones.
Okay, I'm ready. Are y'all ready?
Money
And the
prizes.
buzzer. Who's getting prizes?
She
We
said
discussed
money
there
and
being
buzzers
prizes
involved.
and buzzers involved.
Why we do need a buzzer?
We do.
I have buzzers.
Oh.
Next time.
That's right. Next time. Okay, so it's so funny that people ask about poop.
I mean, that's not really funny. It's
You
kind
guys
of cool.
love it, but you guys love poop.
Look at Maribeth. She's getting excited.
Okay, so I guess the question came in. Normal pooping habit. Once a day? I know. I can't believe I just said it. I can't even say it.
I know. She doesn't. She whispers it.
Normal habit.
Got it. The P word.
The P word.
The P word.
What about normal?
What's normal?
Frequency.
Frequency. Oh, can I take this one?
Yeah, go for it.
Please.
Honestly, perfect gastrointestinal health, perfect microbiome. You really should be having a bowel movement after every meal.
Oh.
That being said,
I was sorry.
Yeah. every meal, if everything's working in perfect harmony. We don't necessarily live in a society or have a food source that allows us to have the perfect microbiome. So for the most part, normal is once a day, minimum. So for these people who think normal is every other day or every third day, because that's what they've done for years, it just is a reflection that their gastrointestinal health has not been good for many years. But yeah,
That's funny you ask, because one of our clients said, what's wrong with me when I eat something and it's immediate? But that's not wrong.
There is something called, it depends on the quality, the character,
There's a
I'll be
whole
right back.
scale. There's a scale.
what your stools look like, because there is something that is not normal called dumping syndrome that occurs when you eat and you immediately feel the need to have fast, furious, really liquidy stools. That is not normal. But a
Okay.
formed bowel movement post each meal is pretty normal. I didn't say common, but that's normal.
I mean,
I learn something new every day.
I love this stuff.
Happy
I
being here.
know,
Why?
you guys.
It's because if you've
Don't
ever
get
had
that.
issues, you will love it. I think. Maybe I'm just weird.
This started, just to give a little bit of background, all the poop talk started when the poop studies came into play.
Yes.
Because
Yes. Because
it's
there
one
are
of
you guys are like
fascinating.
nerds and you love them.
It's fascinating.
You can tie most every aspect of health, even from mental health, anxiety, depression,
Right.
to
Gut
physical health, joint pain, muscle
To gut
pain, to your gut health.
Your microbiome.
So actually, one of the best things you could ever do or treat yourself to is a stool study and have someone evaluate that. Because you may fix a myriad of troubles you didn't even know you had.
I love how you said treat yourself too.
Well-
That's not on most people's Christmas list. But
Since
maybe
we're
it should be.
talking about this topic, is it important, like, are there 3 things that I should be doing every day to support at least once a day, ideally 3 times a day if I eat 3 meals a
Drink
day?
lots of water.
Water,
Water,
fiber,
Fiber.
goal, decent goal is
Non-processed
30 to 35
foods.
grams a day
Okay, water, 30 to 35 grams.
of fiber.
Move my body.
And
Yes,
move your body,
that's
baby.
a-
That's a
Manage
good
my
one.
That
stress.
was a good one, yeah.
Always comes
Yeah.
back to that. But
There you go.
Okay.
We gave you a bonus one.
We started out with a bang.
Yes. Love it.
Okay, this one, I don't know who wants to take it, I can guess, but cracking your knuckles and popping your knees. That mean you're going to get arthritis?
No, that doesn't mean anything. We used to think that back in the day, they said you would develop arthritis if you popped your knuckles and all that stuff. That's not true. There's no evidence to support that. There's no evidence to support that you're going to get bigger knuckles. That was another thing, was that they would get bigger, and there's no evidence. What it typically is it's called cavitation. So there's liquid in your joints, like fluid, synovial fluid, and so little air bubbles can get in there, and then that's what's popping when you do that. Now, I will say if popping is painful, that's a sign that something's not right. Like if your knees pop and snap and crack and it's painful, sharp pain, probably want to get them investigated. If it's just popping because you moved or you're walking or just moving, you're fine. As long as there's not pain.
are some people more bubblier than others?
I think so, yes. I do. I
I mean,
think
there are some people
are
that
more-
can
yeah.
crack their
Yes.
pop their knuckles or joints like a pro.
They do. Now, I will say I'm not a fan of intentionally cracking, and I don't have any evidence to support this, and normally y'all know I like to have evidence, but I would say that if you're intentionally doing it all the time, I would hazard a guess that if you're 12 years old and you're doing this until you're in your 50s, 60s, there is potential for some ligament laxity to occur. Or capsule laxity. Do I think that it would damage you and cause pain later on? No. But I mean, if you don't have to pop yourself, don't. It's not a party trick. Or shouldn't be a party trick.
Oh, shoot.
Or something to annoy your mom.
Or something to annoy your mom. But, some people are, yes, more poppy than others. I think.
Oh, if you could pop
Yes.
your eye roll,
I
that's
definitely.
a mom annoyance thing.
But no, you're okay.
Essential.
You're not gonna get arthritis. You're not gonna damage your joints. You're good.
So when you like squat down and your knees go cracky crack?
Sometimes that's just normal.
Okay.
That's just normal. Some of us crunch.
Good
Some,
to know.
I have
I have
some
a whole
crunchy
freaking
knees.
jug band going on
Or
in my
crackling.
body on some days.
Some days you pop a lot. Yeah. My knees crunch when I squat, but it's not painful. So things like that is usually, if it's pain free, you're good.
I think that common idea was that you were going to get arthritis
It
when you're
was-
older.
To be
I've
fair,
heard that.
I know. To be fair, when I was in PT school, they would even kind of, I
They
wouldn't
taught
say
that.
they taught that, but they would definitely kind of go, well, and they didn't have a good answer, and now I don't think any research supports that at all.
And they say popping joints limits your ability to be a ninja.
It does. It very much does.
All right, let's talk about pain causing anxiety or vice versa. What's the relationship?
That's
Which
your
comes
brother.
first, the chicken or the egg?
Both. Yeah.
Well, anything that hurts could make us uncomfortable or think something's wrong. And what would be a common response to discomfort? I'm anxious. I mean, I don't have a scientific...
Some people are more wired to go to worst case scenario too, yes?
Right. If I am wired to worry, if something hurts, then I'm going to perhaps become catastrophic.
That's a good question. Sorry, not to
Yeah.
disrupt you. But are people wired differently that way? I mean, I have worriers in my life, but are you more prone to be a worrier versus less prone?
Well, we're wired to survive. That
Okay.
would be our baseline. And scanning for threats
Okay.
could be amplified. If I'm scanning for something that's going to hurt me, the tiger,
Yeah.
that's my baseline worrying. But do I believe some people take that
To a different level?
Yes, to a different level. And no judgment. It maybe is just the way we were created.
Is there a sex variation on that?
I don't think there's a difference between men and women and worry
Interesting.
or experiencing stress. Maybe we could talk about personality types,
No, sure.
nature and nurture. But I think our system, our nervous systems are the same. But I think our sensitivity, would that be right? Would be different. So if something makes me uncomfortable, I think I'm sick, I hurt, anything
My
around
joints
that,
are popping.
I'm cracking, my poop is not enough. It's all about how you're going to respond to that. And some people maybe respond in more extreme ways. And we all can help with that. From your lens and mine.
I think when you talk about the pain part of that, I think some of it comes with your comfort with the unknown as well.
Control.
Clients that are in pain that I have that are more comfortable not knowing or having a diagnosis tend to have less anxiety around their symptoms than someone that has to have a diagnosis or feels that, like, what is wrong with me? What is wrong with me? I need to name it.
Right.
In my world, we can't always name it. Some things are just because, and I
Don't you
hate
think that common
answer.
thinking is if you can name it, you can fix it?
I
And
think
if
that's
you can't name it, you can't fix it.
yes. I think that's a misperception in my world, though, because a lot of times I can name it, but I can't always guarantee there's a fix for it. And sometimes I don't need to name it to be able to fix it. But yeah, I think that part of the anxiety comes with what's your comfort level with not having a definitive diagnosis, and what's your comfort level with not knowing how long it's going to take to feel better. Because there isn't a quick answer a lot of times. And so I've noticed my clients that have more anxiety around their pain and symptoms do tend to have that a little bit more I can't say that word. Catastrophizing.
Beautiful.
Sometimes Google, Dr. Google doesn't always help. Sometimes it does.
Dr. TikTok's not very
Yeah,
favorable either.
so I think, and it being able to kind of talk through some of that though too, and where pain is. But pain, I think, does also play a role in anxiety because there's a lot of stuff going on, and you've got a heightened sensitivity with your central nervous system, and I think that can play into anxiety as well.
Here's one. Can you treat one without the other?
I don't think so.
I don't think so, because stress makes us grow. You can't eliminate, control, or your list of whatever it is. There's always going to be something on that list. I think a more adaptive goal is to learn how to respond to uncertainty, to discomfort, to that which is not known yet. You don't know
Agreed.
what's around the corner.
Well, and if
You're
you're doing
prepared
that, you're
for it.
fixing both issues, both the anxiety and the pain.
The pain, yeah.
Regardless of whether
Yes.
chicken or egg came first.
Yeah, because a lot of times you bring your anxiety down, your pain level will come down. If you fixate on your pain, anxiety goes up. So there's definitely a correlation that I've seen with it.
Adapting is, I like that.
Adapting.
As a strategy.
That I can handle this.
Yes.
We had a lot of women here, so a lot of women gave women's questions. I think this is a
Sorry, Jim, if you're out there watching.
well. We this is actually for the men too. We had
Jim
somebody
White.
ask, how do you best support a partner with ED?
Pauline?
Gosh.
I can give you some thoughts. Hey, I got some answers.
That's a loaded question because I'll answer a question with a question. I would like to know why that person's having ED because there's a lot that plays into it. Is it a mental issue?
Mm-hmm.
Is it a physical issue or a medication issue? Is it a hormonal issue? So I think
I'm an out of practice issue.
out of practice issue. My first response would be support them in getting to the why of the ED, and then the support from that point is just depends.
Fair
Because can all systems have hiccups?
Yes.
And so a hiccup is not broken defective, I need medicine.
No.
You maybe look at how you get unstuck. And that, I think, would also go back to your personality. Does love, compassion, tough love, humor, the connection with your loved one help? Or your relationship with a trusting professional, your doctor, or...
I think ED's interesting because I spend a lot of time obviously talking to women, and it's oversimplified, but libido in a woman, there are so many factors that play into a libido. You know, are your clothes clean? Are there dirty dishes? Do you have the time? Who needs picked up where? Not the least of which, how do I feel in my body? There are so many factors that play into a woman's libido. So treating, it's not ED because it's not erectile dysfunction, but treating low libido issues, sexual dysfunction in women is so tricky. And then you would think that the contrast that men should get off a little easier, but their problem is usually erectile dysfunction, which we think should be easily fixed, and it's not, because just as many things that go into a female's libido, does she have the desire? So many of those factors, to your point, is it your mind, is it your body, is it your hormones, is it your performance anxiety? Those factors is where we see in erectile dysfunction.
I think one piece, 2 comments, one probably a little humorous, one not. Serious one being willing to have the conversation, though, because there's a lot of taboo around talking about it.
From a supporting standpoint.
From anyone, even if it's you. So men and women both don't always want to talk about
Shame.
it.
Yeah.
Because there's shame. What's wrong with me? Why can't I should be able to perform and I can't. What is going on? So they don't even want to bring it up. Then the other person might be uncomfortable talking about it. So you have to be comfortable having a difficult, uncomfortable conversation and being willing to listen.
Growth happens in the stress.
Right. And then the humorous part I was going to add was when you were talking about all the things. Throw in ADHD and see how that goes. Whole other story when it comes to...
Whole other.
We don't have that much time tonight.
So you gotta be willing to roll with some interesting things, but I think just the conversations and being willing to have them, because it's tough. You don't want to bring that stuff up, even if it's a partner you've been with for 25, 30 years. It can be, I think, very disruptive in an emotional capacity to be like, well, it was fine, a couple months ago, and now what happened? And you start to feel broken, or what's wrong with me? And especially women, and I think men do too as well, have this, I should be able to fix this. I should be able to fix this on my own. And I think that's maybe the support part is like, we're going to have this conversation, and I'm here for you.
Acknowledging it first, and then...
Yeah.
Well, I think this format, we got a lot of questions about poop and about sex. So I'm just going to go with my next one. Somebody asked if birth control...
conversations about sex.
You're not. I've had that.
Let it rip.
You'd be surprised how many you have.
Well, you guys are doing great so far, so I'm going to ask the next one. Can birth control lower libido permanently, or does it come back? And I was unaware that was a thing, but somebody did ask about
very
that.
much a thing.
Okay.
Yeah, a lot of birth controls. It's not an absolute, but it is a pesky little side effect of most
Somebody
birth
did
control.
ask that.
Most hormonal birth controls. It's not a side effect of IUDs or a side effect of condoms, but yes, hormonal oral contraceptives, yes, and it's usually temporary.
Antidepressants too.
Yeah, there's a ton of medications that impact just libido.
Blunt your affect.
But most of those, if they're medication induced, are reversible off medication.
So if you're on something like that, will they switch it?
They could. I mean, that is one indication that worth a real discussion of what your other options are.
Okay.
Yeah, absolutely.
Well, good. I hope they're tuning in and they get that answer.
If not, I'll get Walmart later.
Just walk up and ask.
Oh dear.
You just
Where's
opened yourself up with
I
some
did.
conversations in Walmart.
Okay, so here's one. Somebody works a desk job or like an office job. Is sitting in a desk chair 40 hours a week, is that bad? Does that do damage?
I'm not gonna say it does damage. Well, actually, that's not true. I think it
What's
can
the
do
science?
mental. I think it can do.
It depends what you're doing
Yeah,
with the
physical
other.
damage.
I'm doing math in my
But
head.
is it going
16
to?
hours of the day.
Well, if they're going to, like, does this damage my back? Does this damage my body? In the sense that it's damaged. No, I just felt like I was sliding off the couch.
Pressure. She sat up.
I gotta get, put on my serious face. But So no, I don't think there's damage in that sense. Are you going to experience pain? Probably. But if you sustain one position for too long, that your body's way of telling you you've been in that position too long is to start to be uncomfortable. So
whether that's sitting or lying.
standing, lying down, walking. If you do anything for too long, that's why we have a variety. I like a variety of postures throughout the day to help. So it's not going to necessarily damage you, but it's not going to help you either. You can end up with, some musculoskeletal aches and pains for sure. If, like Maribeth said, what are you doing with the other part of your time? If you're not taking care of your body otherwise, then yes, you're going to see some musculoskeletal aches, pains. You're going to start to have some pain, like some chronic pain potentially pop up. You got to take care of yourself.
Metabolic issues.
Definitely some metabolic issues. I would say too, there are some mental issues that come with sitting at a desk and being in this one place all the time. If you're not, exposed to open windows, if you're in a cubicle and you don't have sunlight, So I mean, I think there's some
Well, there's all
multifactorial
those
things.
pads and those standing desks and like the ball.
Yeah.
Are those just gimmicks, or are they worth it at all?
You know what? If you can walk and type and work, I'm all for it. I would break my face. I would fall off. But I
think there are some jobs that are more adaptive.
conducive
Conducive too.
But if you can't, I'm a really big proponent of stand-up desks. Like, I really try to tell people, don't sit or sustain one position for more than an hour and a half, 2 hours max.
Okay.
So if you are sitting, go get a stand-up desk, stand up. Take
That's
a
very
lap.
good.
I'll tell people, set an alarm to go up every hour and a half, 2 hours. I don't care if you have to go to the bathroom. If that's the only place that you can take a lap, take a lap. You just need to get up and move. And then stand a little bit, sit a little bit.
And
walk
do 5
around a little
squats
bit.
before you go to the bathroom.
You can, and you can do 10 squats after you eat.
Micro breaks in my
Yes.
world is what we're
Micro-
talking about.
Yes.
And
Scientific term.
if your job is mundane or remotely stressful, you need a stress break,
You mentioned
a movement break, mental break.
Something. But
60 seconds, 1 to 3 minutes every hour.
postural
Use it
variety,
every hour
postural
and a half.
variety, just
Move.
movement variety. You got to do
No more
something.
smoking breaks. Now we need micro breaks. Perfect.
There you go. Yeah. Don't put smoke.
Yeah, no, not worth it. Not worth it.
That's bad.
Okay. Here's one. Oh
Pretty
my
face
god, you
your
guys
face.
don't know how hard this is.
That
for me.
face was
Are you gonna be able to
painful.
say it?
We're ready. We're ready.
Here, will you just read it? I was gonna pass you guys notes, but
No, you got to say it.
Come on.
If we got to talk about it, you got to read the question.
okay.
Growth happens in the stress.
Give it to us.
They can't see me, so is it normal for vaginal odor to change throughout the month? And when is it a problem?
Oh, absolutely.
Oh,
No, that's a great question too.
Yeah, it is. I know.
It's a common concern, especially for younger girls who are too embarrassed or whatever to
I
ask.
remember it varied throughout the month.
Well, your
Every 30
vaginal
days.
odor changes because your vaginal discharge changes, and all that's driven by hormonal changes. So yes, in a woman, even on a wonky cycle, you are bound to get different essences. Some better than others, certainly. And then if you add activity into that, that's going to change as well.
And diet.
And diet,
Mhm.
right. The time to be concerned about it is if it itch, irritates, causes pain.
Okay.
So normal.
Yeah, all vaginal discharge is not bad.
Okay.
The other time to have it evaluated is if you don't know. So it's okay to come in and I will look and test and whatever and say, no, that's fine. And then you've educated yourself and you know that's okay. But the change in odor is due to the change in discharge, which is due to the change in hormones.
So you might also guide me on what I put in my body, water and healthy foods.
And what you shouldn't put in your vagina.
That's right. Like products that are no-go.
Vagina is a self-cleaning organ. You should never put anything in there that's artificial.
So this is
No
my
douching.
I was going to say, because that was back in the 80s, 90s.
Oh
that
my
was a
god,
huge
that was
thing.
huge.
But I was under the impression that it's not good for you.
it changes the
your pH,
flora
right?
of the vagina, and then it can't
Not
defend
good.
itself as well.
What about the feminine soap products?
Nothing.
No.
Just leave it alone.
Yeah.
Let it do its
Yeah.
job.
If you're going to use soap down there, something that's I was going to say corrosive. That's
No comment.
gentle. I'm thinking like Dove, unscented.
Not correct.
No comment. No comment in the vagina. Comment or comment, right?
Oh my
Guys,
god.
it's been a long
You
time.
probably need to come in after that.
Oh.
But
All
a
the
gentle
ladies soap
soap.
I've invested in.
I feel like your phone is ringing off the hook as we're sitting here.
But so then, on that note, because a lot of things too directed at women, feminine products are very florally scented, but it would be unscented, right? Like you don't need to smell like a bouquet down there.
You do not, no.
And then
You should not.
Yeah.
Because any of that artificial stuff is then changing your natural pH and is declining the defense mechanisms against urinary tract infections. So and vaginitis.
I'm totally adding on to this too, because this is also sweating and wet. You want to try to get out of them as soon as possible, right? Because that can lead to some of the changes that can result
Bacteria
in
and yeast in particular really like more moist environments.
So
Out in the dark, and they are so happy.
yeah.
So yeah, if you're exercising, get out. Same thing with a wet bathing suit.
Yeah, just out of them
out
as
of
soon as you can. Because that's a big thing.
Preferably into cotton panties. I'm a huge cotton panties.
I was
fan,
gonna. You read my mind.
Well, then
What's the fabric?
Cotton panties. What about liners? You know, us older people leak.
unscented, thinner the thinnest
Thin
possible,
daily
right?
liners.
Thin daily liners
Change.
and change frequently.
Yes.
Yeah,
And then cotton's
because you're better off with that than you are staying in wet panties.
See, I'm telling you, like these are things we need to talk about.
I
Like,
know.
because they didn't. I was not told these things when I was younger.
No, and
good to
it's
know.
changed.
Yeah, it does.
Some of
It
the
has
information
changed,
has
yeah.
changed.
Because back then it was like it was just weird. There was weird things, but and then thongs, lace, like all that stuff. I mean, I'm not a fan. I'm just saying, but
You're not doing your vagina the
irritate
best
things,
service,
right?
Right.
I think we need to go back to cotton granny panties. That's all I gotta say.
That's what your hoo-ha likes the best. I mean, seriously, because it's moisture wicking, yeah,
Oh, it's
non-irritating. Yeah.
I mean,
The best panties, hands
Same.
down, are the ones they give you after you deliver baby in the hospital.
really.
Oh my goodness, yes. They're elastic. I took 4
That
pairs.
was
Yeah. I think I know exactly what you're talking about
Because
I
they're
have-
built to go up
yeah.
over, your big belly. They're awesome.
They hold it all in. Just keep it.
It's like a big panty hug.
Little. I steered us off course a little, but it was kind of on topic. Next
We're getting to know you guys so well tonight.
Uh,
Anyway, what about sleeping? I mean, this is
That's a
Meaning
loaded
what?
question
I was like,
as well.
sleeping-
like,
What?
how would you sleep?
I recommend
Oh.
sleeping. Oh, what do you sleep with?
sleeping is good.
Try not to say words.
That's a little personal. I mean, it's very much personal preference. Airing it out is probably a really good option if
Okay.
you can tolerate it. Second best would be cotton panties.
Okay,
Yeah.
fair enough.
That was the question.
Oh.
Sleeping's good.
Okay, I'm going to go with an easy one now for me. Is a sprain worse than a break?
Not really.
Ah,
I mean, depends on what you're talking about.
I'm thinking
If-
bone.
If I had to choose and I was going to sprain my ankle like a grade 3 sprain and or break my ankle, I'd rather break my ankle. It's gonna heal faster.
Breaks heal faster.
They do,
Got it.
right? Bones will heal within 6 to 8 weeks typically, unless you've got some other stuff going on. Ligament damage, like from a sprain or like where you've stretched out the ligaments, take much longer.
So
And
you
if we're
really boogered yourself if you broke it and pulled a ligament.
yeah, you
Yeah.
can. Yeah, but ligaments,
Overachievers.
like ligaments, tendons, once they're stretched, like they're not going to go back to where they were before, so they're always a little bit loose. So you can have some issues after that. A break, the bone is going to pretty much heal. Like you almost wouldn't know. I mean, in a future X-ray, you would know, but you can always tell when someone's had a sprain. So I would say like, neither one do I want, but if it fractures are going to heal a little faster.
That's crazy because I think people go like after my kids have sports injuries. You go, you
Oh,
get
thank
lacerated.
you.
Oh, thank
Yeah.
goodness, it's
Yeah.
not broken.
Yeah. But in my
Too
in
late.
my world, I'm
Yeah,
like, you would have been
it's the
better off if
opposite.
you broke it because
Have a
I
longer
look at
recovery.
the recovery, and there is a false, like, especially with ankle sprains, with my athletes, that like, oh, it's a grade 1, I'll be back. Like, just because you can start walking and playing again within a week or two, you're not okay. You're more likely to sprain it, and so then I end up seeing people, they end up with the
Longer
higher
term
level,
issues.
they have balance, proprioceptive awareness is down, they end up with a bigger sprain later, so.
That's a big word.
Very big word.
Sorry.
Proprioceptive.
Oh,
That's balance
But-
for you out there in,
yeah.
in
Body
Facebook
awareness.
land, right?
But there is. It's like, oh, I rolled it. It wasn't bad. It's a grade 1. Yeah, I get that. But you still need rehab afterward, and most people don't ever get it, and then wonder why on the road. Well, I roll my ankle all the time. Yeah, well, that's why. And that's just a fallacy. So I would say, yeah.
Oh yeah, I totally remember that. Like, oh good, it's not a break.
Yeah.
Now I was wrong.
So, oh,
Sorry, kids.
Get back out there and play.
Suck it up.
Stick it up. Walk it off.
Oh, okay. So I had one for Kim. Where was it? Oh, why do small things trigger oversized, I think is the word she wrote, emotional response or reaction?
Well, could you say that the brain doesn't know the difference between a little stressor or a big stressor? That could be a piece of it. Or your brain generalizes when it is uncomfortable, the response. And I think wear and tear, life, loss, threats to your safety, just the accumulation of being exposed to stress overall can narrow your window of tolerance. And there are 101 ways to strengthen or expand your response to stress. So it could be two things going on.
The straw that broke.
The straw that broke the camel's
Yeah,
back. Yeah. Because is it kind of like you're just overstimulated, you're overwhelmed, and then something, it's kind of like that last piece, like
Right.
that just puts you over the edge?
Right. We sometimes in the first responder world use the stress bucket analogy. It doesn't have to be the worst call that you experience on the job, the nastiest, the most graphic, the hardest. It could be your child doesn't put their dishes in the sink. So again, I think it's just a matter of what your baseline is, how you respond. The brain doesn't discriminate. I hope that helps. Sort of what you were saying.
Yeah, that makes total sense to me.
I hope they're watching.
The replay will be.
Yes. I'll call her and say, hey, check it out.
Check it out.
Oh, here's one. I think somebody mentioned it earlier. Leaking urine during laughter or exercise. Something we should accept as normal?
Oh, heck no.
Okay.
I'm so proud of myself that didn't come out as a cuss word.
It did.
No. It is not uncommon, so it's not abnormal, but you don't have to accept that as normal. There are lots of fixes for it. And they run the spectrum of it. Again, I go back to the whys on a lot of things. It depends on why it's happening in the first place. It usually represents some sort of flexibility is not the word I want. Laxity of the pelvic floor, so it doesn't support your urethra as well. I use my handheld bladder. This is my bladder. This is my urethra to the outside world. There's too much wiggle here. So when you laugh or you cough or you puke, there's no built-in kink that prevents you from leaking anymore. There's different degrees of that laxity or that flexibility. So it really depends. The spectrum of fixing it so you don't accept it as normal is anything as simple as maybe you just need a little estrogen to boost those tissues and make them more youthful, give them their elasticity back, all the way to their surgeries that can be done too. In the middle, there's pelvic floor physical therapy, which is fantastic. I'm not a big fan of Kegel exercises because most of the time they're done incorrectly and they can actually do some damage.
Yep.
But there's a lot of work that you can do on your pelvic floor to help re-support it too. So, no, absolutely do not accept that as normal.
That's nice to hear.
Unless you just had a 10-pound baby and you're a week out from that, then it's probably normal and it will get better.
But that, I think, is the misperception, because I, thinking back to, I think about my mom when she was younger, she just thinks it's normal because that's what she was told, because I think everyone was told after babies, oh, it's just normal,
It is normal, but you don't have to accept it.
But
There's a fix
for
it.
long term, we're told there's
Yeah.
nothing to worry about, that's just how it is, and there's still that perception that after you have a baby, you're going to leak. I don't think that's true. I think you can fix it, but I think a lot of women are in that perception of there's nothing I can do about it. It's what it's supposed to be.
At one time, and I haven't looked into this within the last couple of years, but at one time there was more money spent on period pad supplies in the postmenopausal period than there were in the actual menstruating age group.
because of leaking.
Because
Or
we-
leakers.
Yeah.
Because of leaking. And yeah, I just think, and then access too now, like in knowledge, like pelvic health. Like I am not a pelvic health. I'll say that right now. I know a little bit about it, and I also agree.
No, it's much like anything. It's a passion, and
It
you
is
want to
a
go to
passion,
someone that
yeah.
has a passion for that.
That
There's a couple
knows.
really good ones in
There
Royal
are.
City,
We can get you there if you need it, but
Yeah.
definitely Kegels are often done incorrectly and can actually make the problem worse.
Increases your risk of urinary tract
Yeah.
infection if they're done incorrectly. Yeah.
It's a very fine
We're
art.
going to have to
do
circle
that.
back to that later because I'm having a hard time wrapping my head around doing them wrong.
Oh yeah.
Yeah,
I didn't even know that was possible.
yeah, it is
It
possible. And then in my world, it comes onto the side of I don't want to jump, run, do all these things that you should be able to do. Now, is there a point where there is some laxity just as we age? I think that's
Oh,
with the
absolutely.
estrogen and my runners. Like we'll say that sometimes my women in their 40s, 50s that have run, the jarring can sometimes result in a little bit of that laxity, but I think that's more the estrogen than it is.
Well, and
anything
I will also
else.
say if it's happening, like you can't predict when a laugh or a cough is going to come.
Right.
So don't accept that as
You're
normal.
not, yeah.
But if it's only happening when you're running or when you go get on the what's the trampoline.
Yeah.
Oh, yeah.
But like if it's activity, there are things that you can
Yes.
do temporarily too.
Yes.
I mean, one of the things is to put a tampon in, and you re-support that
Yeah.
pelvic floor pretty nicely.
Sure. And then I also teach when lifting stuff with heavy lifts. There's ways to so that you need to brace so that you're not bracing incorrectly and pushing down that can cause leakage.
Yeah.
So I will teach my women that stuff too, but you don't have to accept it. And I think that was something that just you were
No,
supposed
but
to
you're
accept
right. It
back in the
had
day.
been a taboo subject for so
Just
very
don't talk
long.
about it. It's like,
Um,
no, there is hope. It is not normal. Like you,
It's normal, but it doesn't have to be accepted as the end. So it's not an uncommon
It's normal at
issue.
certain points.
Right.
It's not necessarily normal forever after having a baby.
No.
I love this posture of asking questions because I'm sitting here learning a lot. I don't know.
I
But being in a place where you can be curious and ask questions and have these conversations that are sometimes uncomfortable. I mean, just normalizing that.
I mean, people go to the doctor, but I think even sometimes they don't want to sit there and ask them. So
Right.
That's true.
Well, we believe everything's figure-outable, so bring it on. What's the next
Figure-outable.
question?
Yeah. And what's the next?
I
one?
love that. Okay, so this one might be for anybody, but why does pain move or change location?
Oh, because I think it could be especially you and me.
Yeah, oh yeah.
Some
the
of
body.
it, some of it's brain related. Like pain,
Stress
we
related.
do not know as a medical field. We know very little about pain. The more research we do, the less we know.
It
Pain is very much a brain thing. It is not really as related to structural changes and stuff as we thought. So we used to be told if you see this on an image, like a X-ray or whatever, then this is what's going to cause pain. We now know that's not true. There's so many people out here with bulging discs and torn rotator cuffs and torn labrums in their hip that have absolutely no pain. Knee arthritis, no pain whatsoever. And other people that have perfect images that are in excruciating pain, and we don't know why. Low back pain, one of the biggest medical things that you will get diagnoses is low back pain. We have no idea why it's there. We have no idea. It changes location. It can be on right side one day, left side the other. So a lot of it has to do with just the brain and how the brain is sensing whether a position, a movement, an activity is safe. And it comes into that heightened anxiety around it. If you
Where
don't
do you feel it in your body?
Yep, where do you
You
feel
tag
it?
your it, it's all the brain's fault.
The body keeps the score. Your
It does.
issues are in your tissues. You got to feel it to heal it. I mean,
Ooh, I like
Now,
all that.
now I will say that some pain is also related to hormone fluctuations, and inflammatory pain can often be worse at night, which people will sometimes say, well, why do when I don't really notice it during the day, and then I go to bed at night and my pain seems to get worse. And that typically
The
tells
brain,
me,
brain plays a role in that too.
It
Because
does.
all day long
Everything's
your
quiet.
brain's busy on everything else,
And
and
it
at night
focuses.
it quiets
Yeah.
down and
you can focus on it, but there's some correlation with like cortisol levels,
certainly.
fluctuations, but there's inflammatory pain tends to get worse at night. So then when someone's telling me some of those things, a lot of times I'm like, that's more inflammatory. I can rule in and out some other things as a causative factor of it. But
so is it a health hormone issue? Is it
all of the above.
a movement injury issue? Or are you responding to past, present, or anticipated stress.
Yes, and
C.
there's definitely all of that.
All of
I'm
it.
going to go
And-
with all the
yeah.
above.
And
D,
the
all the above.
history of pain too. I mean, that can be related to if you've had an experience with pain before that was very, very unpleasant. That can heighten things and make pain jump around. And but yeah, it's very interesting. We don't know very much about pain and why it's there, but we're getting a lot more pain science behind it. There's a lot more research going on, and it's fascinating. But it just shows us how little we know.
Well, the hope is that the better. I'm gonna nerd out in just a minute. The hope is that we have a better understanding of pain, because then we can treat it better and get away from opioids as an alternative.
Yes,
Yeah.
because not
Because opioids are
typically
not the
don't
best
help.
thing to treat
They're not.
pain.
Like muscle relaxers. That's one of the things. Like very rarely do muscle relaxers work on musculoskeletal pain unless it is actually a muscle spasm,
Right.
and very few times is it actually a muscle spasm. And people will be like, "Well, it didn't work." Yep, I know, because you didn't actually have a spasm. So, things for neural pain oftentimes are given don't really work because that's not where it's coming from. So yes, it would hope that we could get away from more medication usage and get into it's very much movement related, tolerance related. What is your capacity
Yep,
to
Reteaching your brain.
Yeah,
Yep.
because our brain does what it does best, and that is protect us. So if it thinks a movement is unsafe, it is going to do everything it can to get you
said
not
that
to do
earlier.
it.
That we're wired for survival.
Yeah.
Right.
So it's going to protect you, and then having to show your brain that things are safe. So there's a lot of pieces that go into that of retraining your brain to know that a movement is safe and is not going to damage you or cause any additional
And
pain.
that's what you were just talking about this morning, which I found really interesting. So will you please share with our audience?
I don't remember what I was talking about.
We were.
Oh,
We won't bring that up, but you were talking about for instance, one way that people treat phantom limb pain
oh, yes.
is with the mirror, which I found really interesting, because you can extrapolate that to other.
Yes. So some of the treatment for phantom limb pain, if somebody has had an amputation and is having that pain in the limb that is no longer there, is you put up a mirror and it mirrors so your actual present limb. Your brain then starts to kind of rewire and think in the mirror that it's.
So if you had a right amputation,
Yes.
they put a
Loading,
mirror up looking at this,
So
it appears that it's your
that
right
I
leg.
have, yes. Then, and this doesn't hurt, and there's no pain, and you're using it and moving it, and your brain,
Your brain
you can
transfers
rewire
it.
there's no pain there.
Oh
Even
my
though,
gosh.
It
because,
processes the signal as the right side.
right, because you can't treat,
Neuroplasticity, right?
yes, because you cannot treat that, you can't treat that type of pain with medication, because there's nothing there.
No, right.
So
That's clearly not a
yeah,
structural
but there's
issue.
there's things like that. Chronic pain is a whole nother realm of physical therapy. Chronic pain patients, meaning
It's truly
years and
fascinating,
years and
yeah.
years. Yeah, there's a lot of research going into that, which I really am hopeful for because
It's one of those things that we've gotten
We
wrong
need it.
for a lot of
Yeah.
years, and we had to
Yeah.
recognize that, and now we can attack it.
yes,
That you don't just have to resort to a pill.
Right.
Yeah.
Because the
Yeah.
pill just
Yeah.
it blocks off it numbs the brain, so you don't sense it anymore. It doesn't really
It's not
fix
teaching you.
doesn't fix the root cause.
Right.
We're all about root cause these days.
yes. So yeah,
And this is, what's that ear thing that you have? Is that for pain?
The TENS machine or some
EMD, not EMD.
the alpha stem.
Yeah, alpha. Yes.
It has been FDA cleared for anxiety, insomnia, and sleep. Some components of sleep.
Okay.
I look at it as a stress reset. I mean, it's sort of helping you adapt.
So, in a roundabout way.
Does it redirect? Is that part of it?
Yeah, you might be asking me too much information.
Whatever.
Uh,
I'm a nerd.
It's an electric current, non-invasive.
Yeah. I mean,
sort of
that's how
talk
the
about
TENS unit does. Is it kind of overrides whatever that natural signal is.
or resetting sort of your baseline.
Yeah.
That's the way I envision it. That if insomnia or anxiety or this discomfort with pain, that it helps
Knock
turn
it
the dial down or reset it, rewire it. That's my simple way of understanding.
Okay, we're still on the pain thing. I guess that's a common question. But is pain during sex ever normal, or should it always be evaluated?
It should always be evaluated.
Okay.
It should always be evaluated because there are probably many more reasons that are treatable versus not treatable. And that's my roundabout way of saying 100% is not abnormal. 100% of painful intercourse is not an abnormal problem, but there's enough of them that can be fixed that, yeah, it all needs to be evaluated.
Okay.
Because they're not, all the problems are not always in the vagina either. Some of them are in your head.
All right.
Sometimes they can be in your gut.
Back to the study. Oh, here's one. I don't know how this is. Why does pain show up hours or days after activity?
Delayed.
Are we talking about
Exercise.
like exercise related?
I don't
delayed
know
onset
if it was
muscle
like an
soreness?
injury or an activity, like working out.
I would say delayed onset muscle soreness, called DOMS. That's after activity when you've done more than your body was.
Yeah, she probably meant, she
Used
said
to.
activity, not injury. So
Yeah,
she
so
probably meant that.
Probably, yes. So that's your body's normal response to doing something like lifting weights that are above and beyond your normal capacity, and it has to do with inflammation and your body's process for rebuilding and making it stronger. So it's varied. Some people will notice it like within 12 to 24 hours. Some people it takes up to 48. I tend to be a 48-hour person, and then I'm like, what did I do? Oh yeah, legitimately
Is it always
heavy.
lactic acid buildup?
I don't think it has. To be honest,
That's
I
what I always
think a
heard
lot
as
of
a
that.
kid.
No, I think a lot of that research is outdated. I don't think it has much to do with that. It's actually funny you say that, because I was reading something the other day that talked about how we used to think that muscles were damaged, like you'd get the micro tears and stuff, and that's why how you got stronger and build up. And I was reading something that says that that's actually not true. That's not really what happens. There's a lot of, and I can't remember all the technical terms like mechanotransduction or something about how it actually occurs. But I think a lot of our information on that is actually incorrect.
Interesting.
As well. But it happens because it's a delayed response, because your body has to, the inflammatory cells or the body's response to it takes some time to get to the area. You have to notice it first, so your body has to set off the alarm of like, oh hey, we did something that's a little above and beyond.
Well, and weightlifting is not like acute, like falling out of a tree.
Right. So it takes a little time for your body to go, oh okay, yeah, we did some work there, and then all the cells kind of have to come in and get into that area, and it's a whole cascade of processes that happen. So it takes a little time, and we have unique tolerances, I guess is a big word we keep using, different tolerances. Some people are very highly sensitive to those kind of responses in their body, so they will perceive it sooner. Some people that are more well-trained, it takes longer for them to develop that kind of response. The more well-trained, meaning the longer your workout history is, you tend to require a bigger stimulus to create that response to happen, because you've trained for years, whereas somebody that's a beginner is going to notice it a lot sooner with less of a stimulus. But somebody that's been training for 20, 25, 30 years, it's going to take a little bit more.
So I work out. Tomorrow I'm sore.
Mhm.
How should I respond to sore?
Keep moving. Just ignore it. And I will say also, there's a fallacy that soreness, you have to get sore to get stronger,
Okay.
and that's a sign of a good workout.
Okay.
I would argue
It's
it's
someone
not.
that needs to hear that message.
Particularly
Doesn't
if
have to be painful to gain.
no, and that is something that a lot of people will say. Oh well, I didn't get sore. You don't need to. I would argue with other people in my field that when you're so sore, and I've done it to myself, and I never do it intentionally, but it happens when you take a break. You overdo it, and then you can't. Y'all know what I'm talking about. You can't sit down on the toilet without like grabbing the wall.
I'm familiar with
Or
it.
you
And
can't
for 3
walk.
days, yeah, you can't walk. You get up and you're like, oh, that's not. No, that was too much. Like you did too much. That's actually a sign of a lot of muscle inflammation, and you did too much. So it's not an accurate sign of a good workout. You 9 times out of 10 shouldn't feel that sore. So when I don't mind a little soreness when I'm working with clients, because sometimes it is a sign of we worked the right area,
Okay.
or we challenged you enough that your body had to adapt. Because sometimes you're understimulating and you won't see changes if you don't get a little sore, but it's not a have to. And the more, again, it goes back to that, the more trained you are, so the more you've been working out, the more frequently you do it, the less likely you are to get sore. But that does not mean you need to like go and add 50 pounds to the bar.
But, so you should not interpret a little bit of soreness as a license to lay in bed all day.
Correct.
The best fix for
The
that
best
is just
fix-
to keep moving.
Best fix for, and I will say for 95% of even orthopedic injuries, back pain, neck pain, any of that, and delayed onset muscle soreness, movement. Move. Just go walk. Walking is one of the best things you can do for pain. It has a
I'm
lot
gonna
to
need
do.
that on recording, please.
I tell everybody, just get up and move. And try not to be, I always tell people, try not to be apprehensive about it. Try not to guard. Don't do the,
Clench.
where you're like this
Clenching up.
and just move. And it's hard, and I'm not discounting that it hurts. I've hurt my back bad enough where I couldn't turn because I thought I was going to cry. But you just keep moving as much as you can, and it will get better over time.
Yeah.
But movement is the best.
Well, that makes sense because I feel like sometimes I wake up and not moving, and once I get moving, the pain gets
Feels
better.
better,
So
yeah.
the movement does.
Your
help.
joints get oiled.
Yeah, and I say
Yeah,
90,
exactly.
I say 95% because there are some injuries that no, don't move. If you've got a fracture, I don't want you to get up and move it. Let's not do that.
Do I earn a massage if I'm sore?
Yes.
I'm not. I mean, absolutely. I'm not going to say that it's not going to help you. Now, it might be a little more uncomfortable and not as pleasant as your normal one, but
Correct.
it can help with some of that soreness. Epsom salt baths, some people swear by them. Heat is great. I'm not a big fan of ice.
Fluke's balm, magnesium sulfate.
Yeah,
Epsom's,
that can help. Yeah,
Salt
all of
water
those things
wellness.
can help.
Saltwater wellness.
But truly, it's just move and then keep working out. Don't skip your next workout because you're sore.
No doctor's note.
Yeah.
You're
No,
not
doctor.
gonna
I'm not giving you a note.
My sympathy
can't
is
get out of
low
pee.
on that, right? Right.
That's been an argument in my house the whole time, like heat or ice.
Okay, so
Oh.
I'm
Just
always
tell us.
look. I'm always very, very clear. You do what you want. I am not a fan of ice, and I very limited use of anti-inflammatories, over the counter or prescribed. New research is coming out to show that they both delay and prolong healing. So if you're trying to get better sooner, don't take it, because basically what you're doing is you're shutting off your body's response to damage of any kind, whether it's micro trauma from working out or an injury, is inflammation. That's what's supposed to happen in the acute phase.
It's your body doing its job.
It's your body doing its job to heal. So if you're throwing ice on it, you're stopping inflammation. If you're taking anti-inflammatories, you're stopping that inflammatory process. So now you've just stopped your body from doing what it should do to heal. So you're delaying the healing process and you're prolonging it, because once you stop taking it, then your body's going to start trying to kickstart. And then you keep doing this. So it takes what could have healed in 7 days now takes 14 or longer. I also have seen, and this is anecdotal, I don't know that there's research on this, that people that kind of resort to that all the time end up in chronic pain. It's something that could have been an acute or subacute, meaning it's 2 to 4 weeks, is now in 3 months.
Blows up.
And then
Wow.
then you get some of that, like, when is it going to get better? Why am I not feeling
So is
better?
that across the board for pain, or is that more like an acute injury?
I use it across the board because I just want, my body knows how to heal itself.
So like headaches.
I mean, I think that I don't have a lot of headaches, so I think that's up to you, but I also think it's figure out where the headache is coming from. If it's coming from cervicogenic, meaning it's coming from your neck, no amount of pain medicine is going to fix that. So figure out where it's coming from.
We're back to the whys.
Yeah,
I like the
you got to
whys.
dig in. Migraines, certain migraines can be triggered by certain things. Figure out what your triggers are. So I think headaches is another area that is much more nuanced than people want to admit. If it's because the barometric pressure changed, I mean, I think it's fair. Okay, go ahead and take an anti-inflammatory, but it's what is your tolerance? Yeah. I'm just not a medicine person, so I take as little as possible. If I can deal with it, I don't take it. But then I also say, if you've got a function and you're miserable, okay, go ahead and take it. You're not, you got to live your life, but just know what you're doing. And I say all this because back in the day it was rest, ice, compression, elevation, and now it's like, no, you don't want to rest. You want to get up and move as soon as possible. Don't do the ice. Compression, ice and compression, sometimes if it's a severe sprain, I'm going to say acutely yes, but then get away from it as soon as possible. So those are my caveats on that. So I'm a big...
I raised my children all wrong, and I apologize.
But this is current research. I mean, this all comes back to the individual that developed the RICE protocol. He's the one that's come back and done research, and I was like, I was wrong. He can at least admit it.
Oh, that's interesting.
And now we're coming out with these new things of But it's all dependent though. I mean, if you've got a grade 3 ankle sprain and it's swollen, I'm gonna want you to rest, ice, compress, and elevate initially, and then I'm gonna want to get you moving as soon as I can. So I think it just depends. But as a general rule, I encourage you to find other ways to manage your pain.
Well, and I like that you're talking about we've been conditioned to believe that a medicine heals us.
Mm-hmm.
And what you both said, and this could be in the mental health, depression, trauma, anxiety world, that sometimes medication can get in the way of the body's natural mechanism for healing.
I think
Whether
so.
that's
You're masking the problem, not treating it.
Yeah, I think so.
And in worst case, as you said, you're impeding.
wow.
Let me just ask this one more question because I'm like, oh, don't forget that one. 10,000 steps a day. Do we have to walk 10,000 steps a day? Is that the number? Where'd that number come from?
I used to know where that number came from. No. Usually you need to walk more.
You need to move a day.
But there's not a set number.
Okay.
If you walk 200 steps today, then shoot for 250 tomorrow. So my number is different than your number, than Kim's versus Pauline.
Yeah. But I don't think there's a magic number. I forget. I knew at some point where that 10,000 came from. But I don't
Apple
remember
Watch,
anymore.
didn't it?
No, what?
It was that number.
But there is this, like, you
I was
need
like,
to
it's
do
a
that.
nice, like, round number. That's
it is.
convenient.
But you
That
can't
we
get obsessed over it, but you do need to move more. I mean, I think we're way too sedentary as a general population anyway. So yeah, I definitely, like Maribeth said, if you're only walking 200 now, try to get 400 tomorrow and work up. And then there's a sweet spot because I've had clients that like go overboard and I walk 15,000 a day and my knees are killing me. Why did you do that? Like, when do you feel better? Well, if I walk 10, I feel great. Okay, well,
Maybe
10's
10.
probably, knowing what your body's limits are. Yes. It's
And
very
especially
important.
if you're sitting down 8 to 10 hours a day.
Yes, you gotta get up and move.
Every hour,
Yeah.
60 to 90 minutes, move.
You gotta
Take a break.
But
Laugh.
I don't think
Phone a
they're.
friend.
I'll have to look that up though. Now I'm gonna be curious, but I don't know that there's a set number, and I don't.
yeah,
remember.
that was a hot
That was
point
a-
of a discussion the other day.
Yeah.
Like, where's that number from?
Yeah, I forget where. But things come from random stuff.
Yeah.
With running gait, there was it used to be like 180 steps per minute is what you should run. That's the cadence you should be at, and it all just came from this random instance of
Someone was listening to a good song and
No,
decided that was
somebody was.
appropriate.
It was a coach, I think, counting the steps of elite runners, and just
Oh.
averaged it out, and all of a sudden it became gospel that you have to hit that. Not accurate,
They never
but it
counted
stuck,
my
man.
steps.
It stuck. So things sometimes just come out of nowhere or from something very random.
Yeah, that seemed a little too perfect. So
Yeah.
it's like,
Yeah, it's very round, but
Yeah.
no, just
Do you guys have any like little tidbits of wisdom that you want to pass along?
endless amount.
I mean, just in the next 2 minutes.
Be curious. Ask these questions.
Yes,
This is fun.
I feel like I can say this for me. I will not speak for the two of you, but I don't know that there's a question that's off limits for me. Like, I want you to feel comfortable asking. I will find out that answer. And believe me,
I think that's the thing with you is you're like part PT, part detective.
I do. I love it. I want to know why. I want to know why, and I am a very curious person, and I always was.
Yeah,
Annoyed my mom to death.
I believe
Why? Why?
Yes, all the time.
we all need a space where we can ask these questions. So if you don't have that space, think about that. Who do you trust, professionally or informal, to have these conversations?
And I do think, in the broadest sense, there are no stupid questions.
I was just thinking that. You read my mind.
I mean, people can take that
dumb
shit.
questions.
I was gonna say
My only
stole it.
pause to that would be if you ask the same question 20 times looking for a particular answer.
There you go.
And you're not getting the answer you want. But there's really no dumb question. It's always an opportunity to educate yourself. And I am a huge fan of information gathering, so
Be the better you.
I don't know that I've gotten quite to the detective category.
I don't know if I'm a detective. I really love to find an answer.
I like to make the connection.
I like to make it make sense. Yes, I crave the sense.
Yes.
I want
So much. I wish it was more like math because I always like math because there's a
Logic.
answer.
Yeah.
Well, and there's an answer. It's right or wrong. Sometimes I get stuck in the
Black and
gray
white.
areas.
Yes, black and
yeah,
white.
I do struggle with that being in the profession of math because there is no black and white. But I love a good answer and to know why. But yeah, you stole mine. I was gonna say there's no. Just ask. There's no dumb question.
You've been renting space in my brain today.
I know.
babe.
I feel like we've been on the same.
Well, I will
wavelength
tell
today.
you guys, like you guys sitting on that side, but like people go to the doctor and they don't ask.
No, they don't.
I mean, that's what you're
There-
there for. That's
yeah.
what you're paying them
But there's
for.
a lot of.
I try to introduce some of these
around that.
topics, especially in my more traditional GYN practice, like the more taboo topics of painful intercourse or leaking urine, those kind of things. I would 90% of the time purposely bring it up. Now, if you choose not to engage with me, that's on you. But I would try to introduce those more uncomfortable topics to allow them to know that they're not uncomfortable for me.
Yeah,
You
you're
know,
normalizing.
I did that too. I noticed now that you're mentioning that, I didn't realize I did that, but I would do that. You don't think it comes up in orthopedics, but sex does.
Yeah.
After certain surgeries and things.
Yeah.
And I would do the same. I'm just now going, no, I would introduce the topic to let them know if you need to talk about it or want
if you got
to.
questions about it, right.
It's not, I am willing to talk about it, but if they didn't need to or want to, I would, but yeah, I've always been willing to have it. Maybe not always. When I was a new grad, it got a little, that was weird, but after that first awkward conversation, it got easier. Your first conversation at a PT school, getting asked to that, yeah, that was fun.
So I looked up our next month's discussion,
Ooh,
and I actually said, don't forget to tell them, as I forget, red flags that women should never ignore.
Ooh.
Oh, okay.
Yeah. So
We might have to plan for that one.
I might, yeah.
that's what I'm telling you. I'm telling them. Everyone tune in. Red flags women should never ignore.
Okay.
Mm.
Okay.
I will try to be prepared.
Both humorous and non-humorous.
I mean, can you be non-humorous? I don't even know that you.
You can tie it into poop, I'm sure.
Yes,
Oh,
there are red
we
flags.
will be here
I
all
can
night.
I
We
can
will
already
be here
do
all
some
night.
for that.
Mhm.
No, that's a good topic. That's a good one.
It's a
That is
great
a good
one.
topic. Yes. So if anybody has any
Yeah.
questions
So
about
everybody
red
be
flags-
prepared. Send us messages,
Oh, yeah. I'm
and
already,
then
me, what?
you guys.
Oh, I thought you were looking at me.
No, you
I'm already
guys.
coming up with some.
And you don't have to wait till our once a month to ask questions.
Yes, you can find us.
All over social media.
Dancing.
And if anybody wants to give, if anybody has any inflatable costumes lying around that they want to donate, you go right ahead.
Yes, we love
You
to.
guys
We're
do
love
look good in
that.
them.
We'll do it.
Thanks.
We'll even do a dance for you.
Okay, now just.
Bye, everybody. See you next month.